Thank you, Steph. The Wuhan coronavirus has now killed at least 106 people in China, and there are over 4,500 cases. But here at home, 2 patients in Toronto, one officially confirmed by the national lab. The second remains a presumptive case. We are waiting on the official results on that. The couple recently visiting Wuhan. Another 19 people in Ontario are being tested, but despite all of this, officials urging calm and saying that the risk remains low. So joining me now for more, Ontario's Health Minister Christine Elliott. Thank you so much for coming in. I think a lot of people have a lot of questions, and it's fair because it's new. So let's put, in some cases, some minds at ease. When we say that risk is low, how much reassurance do we have there?
Well, we have 2 cases right now in Ontario. One has been confirmed. One is in the process of being confirmed. We have numerous policies, protocols that have been put into place post-SARS. We learned a lot from SARS. We now have a provincial public health unit. We have protocols in place if something happens once a case is confirmed. That sets in motion a whole series of next steps, including locating the people that were on the plane with this gentleman. We are working federally and provincially and municipally with Toronto Public Health. We're all working together in a coordinated way to make sure that once cases are identified that people are treated and contained. So the person who has been confirmed is in a negative pressure room in the hospital, and any health personnel that are dealing with them are appropriately garbed in protective wear. So we are taking all steps necessary in order to both protect the patient, protect the workers, and protect the public.
There's a little bit of criticism with the first patient who was transported to Sunnybrook, whether or not paramedics might have been notified in timely fashion. Do you have any information on that case specifically, and moving forward, what that protocol is like in telling the firsthand, the people who are arriving and transporting, what that looks like?
Yes, in this case, the first responders were ready. They did wear the necessary protective gear, so they were fully protected from the outset. So everyone is taking the measures that they are supposed to be taking. The system is working, and it is a very low risk for people in Ontario to contract
as mentioned,
coronavirus.
Yes. I mean, I think, like anything, when there are still some questions, it's hard to say there's no 100% no, this is not going to happen. We knew it was going to come to Toronto, and it's a matter of the prevention here. You mentioned that you're talking with federal and municipal counterparts. What do those talks look like? Obviously, there's the screening when it comes into Pearson Airport here, which is very important.
Yes, and I have had several conversations with Minister Haidu, the federal Minister of Health, on that issue, so that once someone has a confirmed case, then that sets in motion all of the search for other people that they would have been in contact with. In this gentleman's case, he was on a flight. We've identified the flight and now have been able to identify the passengers that were in close proximity to him.
Had a lot of people online yesterday. There was a number of warnings coming from different universities that people found screen grabs saying confirmed cases at this university, this university, this university. That has all since been debunked. And the problem here now is that a lot of fake news is circulating. And where is the official place to go when it comes to looking at cases and anything that has been confirmed? Because there are still so many avenues to go to. Where do people look for the full information?
Well, you're right. There is a lot of conjecture out there, but we have a website, ontario.ca/coronavirus, that people can check on a daily basis. We update it with the information that we have about the number of people who are being tested, the number of people who are confirmed, and so on. I think it's really important for people to look at this website as the source of fact, as opposed to all of the stories that are floating out around there. That doesn't help ensure public confidence. We want to make sure, and we said from the outset, that we want to provide people with all of the factual information that we have. That's what we're doing. There was a press conference yesterday. There will be another one on Thursday. So we are going to do regular press conferences, but the website is updated daily with correct information.
Perfect. We initially were going to have you on the show to talk about mental health initiatives, but I do want to ask you about that because it is so very important, and there are initiatives that you, as a government, are coming up on with dates. Can you talk a little bit about that?
Yes, well, the issue of mental health and addictions treatment is very important to our government. We did say from being sworn in that we would invest $3.8 billion over the next 10 years in mental health and addictions programs. One of the first things we did was something that was recommended by the Select Committee on Mental Health and Addictions 10 years ago. I was a part of that committee, and it is to create the Mental Health and Addictions Center of Excellence as the bedrock for building the strategy and the foundation for our mental health and addiction strategy. So it's there. It will import the best practices, things that we should be doing across the province of Ontario, and collect the data to demonstrate the how programs are doing, if we're being successful with them. So yeah. I'm very pleased that we've got that foundation in place. Now we're going to be building on that foundation with new innovative programs that we will be bringing forward to the public very shortly.
Great. A lot needs to be done. So please do come back when we talk about that. It's a very important topic. But the latest with the coronavirus, we're going to put the website, connect to you with the provincial government. Great. Thank you so much for that. Appreciate your time this morning. Time now is 8:08. Frank, we're going over to you.